Hey there, it's Dr. Sarah here. Welcome to the She Found Motherhood podcast. Today, I'm chatting with Dr. Elisabeth Marnik. Dr. Marnik is a scientist with a PhD in genetics and immunology who has a passion for communicating clear science to everyone.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Good afternoon. Welcome, Dr. Elisabeth Marnik, to the She Found Motherhood podcast.
Thank you so much for having me.
I'm so excited to have you here, and we are talking about the COVID vaccine and pregnancy and breastfeeding, and I feel like this conversation could not be more timely.
I agree.
And you know what's crazy is I actually did a podcast back in February when it was just released, and I have to say I didn't think we'd be here right now, but
I know. I feel like it's never ending.
I know.
We're all tired.
Yep.
And it's at the point in time where we can't give up yet.
Yes.
But
Agree.
we all want to, but it's not over yet.
No.
It's not over yet. So
Okay. I'm excited about our conversation today. I think a lot of people will listen and get informed and empowered and make a safe decision for themselves, their pregnancy, and their family. So I thought we could get started with, I'm just going to ask you to introduce yourself, tell us a little bit about your background, and how you got to be where you are today.
yeah, as you said, I'm Dr. Elisabeth Marnik, and I have a PhD. And my PhD is actually in immunology and genetics. So I studied all about the immune system. I focused on how your immune system responds normally, and then what can happen if that process goes wrong and contributes to people who have autoimmune disease. So I did a lot of that research to get my PhD. And then during that process, I got really passionate about communicating science to people.
Mm-hmm.
So now in my full-time paid job, I am an assistant professor where I teach students, undergraduate students who are interested in going into medical fields, all about science. I primarily teach biology, microbiology, and some biochemistry classes, so it's basic science stuff. But in my spare time, I run an Instagram account called Science with Liz. And I do that really intentionally. I started during the pandemic kind of by accident. I was doing a lot of communication on my personal Facebook and Instagram pages, and everyone started wanting to share that. And it was at the point where some of this stuff is so controversial when it should be.
Yeah.
But I was like, I don't know if I want my personal Facebook page like going out everywhere. So then I made the Science with Liz account. And I was doing a lot of outreach before then too, but in different capacities, more locally in my community. And I do that because I think it's important that individuals who will never enter my classroom have the ability to access information they can understand. I love teaching my undergraduate students. They're awesome and they're great. But most students or most people who need access to this kind of information aren't going to enter a classroom that's teaching them science. But I think the pandemic has really shown us that now more than ever, we need people to have information that they can understand, that's accurate, that's accessible to them where they are. And really, that's on social media. Most people, unfortunately, I think, are getting their information from social media, which means that scientists and medical professionals have to also be on those platforms. Otherwise, it ends up being like a cesspool. It already kind of is, of misinformation.
Yeah.
And at least people can also then find, hopefully, people they can trust that are giving accurate information. So that's my goal by doing this Instagram account. I'm also at Facebook at the same name, Science with Liz. And my goal is not necessarily to convince anybody. I understand that people may be presented with the information and may make different decisions than I do. But I want them to have access to the information that they can understand so that at least they're making their decision based on accurate information and not based on those rumors or those misinformation that's being spread elsewhere.
I couldn't agree more. And I'm so happy to have met you through Instagram. And I've shared a lot of your posts with our community because, especially, you think about people who are in more remote communities. Here where I live in British Columbia, we have a crisis, a primary care crisis. Like, people can't access physicians to have conversations. So exactly, where are they going for their information?
Yeah, and I am in rural Maine, so I have a
Mhm.
similar issue here that we just don't have enough medical providers.
Mhm.
And the providers we do have are overwhelmed and
Yeah.
are swamped with patients, and they don't always have the time or
Yeah.
the ability to address this information either.
Mm.
So it's really important.
I know. I'm so excited. Okay, so I thought, and if you want to start somewhere else, that's okay. But I thought maybe we could start by just understanding the immune system and the changes that happen during pregnancy so people can understand why we talk about knowing that pregnant people are, I do this in quotations, immune compromised, but that people are at
Right.
higher risk in pregnancy. If you can explain that a little bit, that would be really helpful.
Yeah. So the job of your immune system, and this is normally and true of any type of situation, is that it's supposed to identify things that are foreign.
Hmm.
And when something foreign, when you're exposed to that thing that's foreign, it attacks it to get rid of it because it thinks that it's something that's going to make you sick.
Hmm.
So, in the context of getting infected with a virus like SARS-CoV-2, which causes COVID-19, that's relatively a good thing in most cases. Sometimes it can go haywire and cause issues, but you want your immune system to understand when something doesn't belong so that it can get rid of it and it can keep you from getting, hopefully, really sick. But that also means that the immune system is primed to identify that fetus,
Yes.
placenta, as being foreign. So what ends up happening as when you're pregnant is part of your immune system gets suppressed. And you're not completely immune compromised. You're not like
Mhm.
people who are on chemo or on other medications, but you are slightly immune compromised, just enough that your immune system is tampered down a little bit so that it doesn't recognize that fetus or that placenta as being foreign. Because otherwise, if that wasn't the case, then what could happen is that your immune system would attack the baby and attack the developing placenta, and then that would cause issues later on. So it's important that this is part of pregnancy, that you do have that slightly decreased immune response. But as a consequence of that, when you're pregnant, if you're then exposed to influenza or SARS-CoV-2 or other viruses or bacteria, your immune system also can't fight those as well as it could if you weren't pregnant. Because by virtue of you having that slightly decreased immune system, it's helping make sure you can maintain that pregnancy, but also putting you at slightly higher risk of the consequences of then getting an infection.
Mhm. And that's why we know, and we can speak to this more, but we know that so when you're pregnant, you're not at higher risk of getting or contracting the disease than the general population, but you are at higher risk of getting more complicated or more severe disease.
Correct. Yeah. And that's just because initially what happens is when you're exposed, whether or not you get infected is going to have to do with a lot of things like how long were you exposed for, how much virus you were exposed to. That type of stuff isn't necessarily specific to the individual. It's just going to depend on the factors that you were exposed to. But once you get infected, then your immune system starts responding.
Mhm.
And for people who can respond quickly, their immune system can get rid of the virus before they then develop severe symptoms or severe disease. But in the case of pregnant people are more at risk of those complications because again, it takes longer for our immune systems to be able to identify the virus and then mount the immune response because we are in that slightly immune compromised state.
Yeah, and I know we've seen here and across the world that individuals who are pregnant and have gotten infected from SARS-CoV-2 have been at higher likelihood of having, more severe disease like intensive care, admission, needing mechanical ventilation. We've even had people go on ECMO, which is basically when your heart's not working and your blood circulates through a machine to get oxygenated. This is not fear mongering. This is just sharing facts that we are seeing in pregnant people who have been infected.
Yeah, and there's a lot of papers now that show that, especially there's also the risk in the United States, at least, we've seen that with the Delta wave of
Mhm.
COVID-19, that we've seen a pretty significant increase in the risk of stillbirths for
Yeah.
individuals who get COVID-19 while pregnant. And I think it's important for people to realize that, at least in the United States, only when I last looked, only 30% of pregnant people were vaccinated
Oh,
for
wow.
COVID-19, which leaves a huge swath of the
Yeah.
pregnant population really at risk. And I have friends who are working in maternal fetal medicine or in obstetrics across the country, and they're seeing very similar things that once somebody who's pregnant is infected, they definitely are at more higher risk of
Mhm.
preeclampsia and
Mhm.
other complications, preterm
Yeah.
births. Plus, they themselves can get sicker, which
Yeah.
is definitely not something that any of us want to happen, especially now. Earlier in the pandemic, we didn't have vaccines. But
Mhm.
now that we have vaccines, really a lot of this has become preventable.
Absolutely.
But when you're pregnant, I think I'm actually pregnant right now. I'm 14 weeks.
Oh, congratulations!
Yeah, thank you. And I think it's hard when you're pregnant because you're
It
told from the
is.
very beginning that you can't eat deli meat. You can't
Mhm.
take this
Mhm.
medication. You can't do this. You can't drink too much caffeine because all of these things might harm the baby. So it's really hard, I think, when you're a pregnant person to then all of a sudden be thinking, oh, you're taking this brand new vaccine. Why are they telling me I can do this, but I
Totally.
can't drink more
Oh,
coffee?
totally.
So it's really hard. And I really can sympathize with patients who are concerned about this. And I think it's important for people to realize why we understand that it's safe in pregnancy.
Absolutely. And I think too, it's so easy. Like I had a friend who shared with me a website that is, I called it propaganda because it's sharing all this misinformation, and it scares me. And I am like an educated provider and it was about vaccinating children. And if I get scared from looking at something like that, I can only imagine how people who don't have that medical and that scientific background would absolutely be taken aback and be, well, am I doing the right thing? Because it's so it's just capitalizing on that fear. Like we are all humans have that sort of negative bias, right?
Yeah. And I think especially misinformation really seems to prey on women,
Yes.
specifically the primary caregivers who
Yeah.
typically, not to stereotype, but typically tend to be women.
Mhm.
And it really preys on their desire to keep their child safe, whether that child
Totally.
has not yet been born or the
Totally.
child is already born. And this misinformation just really narrows in on that target and hits the core of the
Totally.
fears that most mothers
Yeah.
or I know fathers can also have this concern, but
Yeah.
most parents have to keep their kids safe. And it can
Yeah.
be really concerning.
I know. We're here to conquer your fears. So maybe Elizabeth, you could tell us a little bit about the vaccine, how it works, and how we know it is safe.
Yeah. So I think the first thing I always like to talk about with people is that when you're vaccinated or when you're infected, your immune system is doing the same thing it would do.
Yes.
The, the difference The difference is that the vaccine is having your immune system do it without having to risk the rest of the virus, the rest of the infection. So it's not like the vaccine is giving your immune system some new job to do that's dangerous.
Mhm.
Your immune system goes through the exact same steps it would do. It's just doing it with just a tiny part of the virus instead of the whole virus. Because when somebody is infected with SARS-CoV-2, they're exposed to all of the 29 proteins that make up the virus. That virus turns their body into a viral making factory.
Mhm.
Their body starts pumping out all of this virus. That virus spreads throughout your body and can cause significant issues. We know that it can pass through the placenta and cause infections in the developing fetus, all of those things that are really scary. As a consequence, if that person survives the infection, their immune system starts to make a memory response. But that's really dangerous. To
Mhm.
have to do that, to have to be exposed to the virus and risk it spreading throughout your body to then make that memory cell is really dangerous. That's what we're trying to avoid.
Mhm.
So, what the vaccine does is it introduces your body to a very small part of the virus, and that part is called the spike protein. And that's a part of the virus that the virus uses to get into your cells and hijack your cells to make more of itself. But in the vaccine only has that spike protein. It doesn't have any of the rest of the virus. So it can't replicate. It can't give you COVID-19. It can't do any of those things. And it's actually been modified so that it can't bind to your cells as well. It's just there so that your immune system can see it. And once your immune system sees it, it starts to mount that immune response and it makes those memory cells that then, if you're exposed to the real virus, your body's like, hey, I recognize that spike
Mhm.
protein. I know it doesn't belong and I can get rid of it much, much quicker. Or in some cases, you can not get infected at all. But if you do get infected, your immune system recognizes it as foreign and eliminates it much faster than it would have if you were seeing that for the very first time. And unlike the virus, that vaccine cannot replicate. That vaccine components do not pass through the placenta. We have
Mhm.
data that shows that. So there are no concerns in that regard like we have with the virus. The vaccine is just training your immune system so that you can recognize it, so that when you're exposed to the virus, and unfortunately I say when because all of us will be
We're going to get
exposed
it.
at
Yeah.
this point in
Yeah.
time. But when you're exposed to that virus, your immune system is trained. And my favorite analogy for this is I'm a marathon runner
Mhm.
and I love to run. I know not everybody loves to run, but if you're not a runner, maybe just think about whatever hobby you do, whether that be music or art or whatever. But all of us, if we train, right? If we train or if we practice, we get much better. So I could try running a marathon without training, but I would probably collapse at like mile 20 and I would be in a lot of pain and it would not be pleasant. I could get really hurt. But instead, I train. I spend months and months running to train myself to then be able to finish that marathon. And that's what vaccines are doing. They're training your immune system without having to risk the actual virus so that then your immune system can attack that virus and get rid of it before it has the opportunity to make you as sick or cause as many issues as it would otherwise.
Oh, that's a great analogy. And I really appreciate you saying that because I've I sometimes think think and say some like controversial things. And one of the things I was like, I don't like the term natural immunity because in my mind, vaccines also give you natural immunity because you're not giving yourself immune globulins that are from somebody else. Like your body is naturally responding. So I understand like the sort of the delineation from like immunity from infection versus immunity from vaccine, but I find the word natural can be misunderstood.
Yeah, and that's something that has been talked about recently a lot in the immunology
Mhm.
community,
Mhm.
where immunologists, when we say natural immunity, we mean acquired in nature.
Yeah.
That's what we mean.
Yeah,
But it's nothing like your immune system is doing the exact same thing. Both are
totally.
completely natural.
Totally.
Both are
Yeah.
your immune system doing
Yeah.
it. So now we're trying to distinguish and say infection acquired versus
Oh, yeah.
vaccination acquired. It's just going to take some time to get, especially the older immunologists,
Yeah.
on board with that terminology. But
Yeah.
I agree that unfortunately, natural has such a different connotation now that we have
Mhm.
to revise our
Yeah.
terminology so people understand that it's your immune system doing the work in both cases. Your immune system is what's pumping out those cells. You're just making sure that your immune system does it with what's safer versus the virus for the first time.
Yeah, absolutely. And I'm really glad you made that distinction. And I'm also glad you mentioned a few things that we know is that the vaccine cannot pass through the placenta. And that's a big concern I know a lot of my pregnant patients have is that they think that the vaccine is going to stay in their system, circulate, and pass through the placenta.
Yeah, and we have really great data now that shows that the vaccine, if you get vaccinated, the vaccine components themselves only stick around for a very short period of time. One analogy that was circulating around early on in the pandemic was like, it's just like a quick message and then it's gone. And
Yeah.
that's what happens is
Yeah.
like the vaccine's components are around just long enough, a few days, to get your immune system to respond and then they're gone. And then they can't pass through the placenta. But what can pass through the placenta is once your body makes those
Mhm.
antibodies,
Mhm.
those antibodies can pass through the placenta. And then once that baby is born, that baby will then have some protection, not full protection,
Mhm.
but will have some additional protection against SARS-CoV-2, which is a
Yeah,
great benefit of being vaccinated.
totally. And it's my understanding that it's IgG that passes through the placenta. And somebody used this term, and now I appreciate it so much more, is that IgG is a robust antibody. Like it sticks around a little bit longer than some of the others, correct?
Yeah, and IgG are the only type of antibodies that can pass through the placenta. They have a special little pathway to do that. All the other antibodies and all
So
the other kind
cool.
of immune system cells can't do that. But my mentor actually in my PhD program, that's what he studied. He studied
No way. That's
he
so
did. He
cool.
studied the transfer of antibodies through the placenta. And
Amazing.
it is pretty amazing, but it's only IgG. So we don't have to worry if you get an mRNA vaccine or
Yeah.
AstraZeneca or any of those types of vaccines, none of those components are going to go into the fetus or and cause that fetus to be exposed to the vaccine. They're only going to get that benefit of those IgG antibodies.
And those antibodies typically would last, would you say, 3 to 6-ish months? Do we know yet?
Yeah, so we
Like
don't have
from passive immunity from the mom to the baby. Yeah.
Yeah, so we do know that background antibody. When you're pregnant, you have lots of antibodies in your blood. Those IgG antibodies, all of them can pass through the
Mhm.
placenta. And that's why some of the vaccinations are delayed until 2 months, because if you got vaccinated, if the baby got vaccinated sooner, the antibodies that they got from you could actually make the vaccine less effective.
Mm.
So you delay some of those vaccines until the period of time. And it's, typically between 2 to 6 months, depending on the antibodies. And I haven't seen specific research that shows how long the COVID-19 ones last,
Yeah.
but typically it's within that 2 to 6 months window.
Yeah.
Hey, Sarah, do you know what I've never asked you? Did you take a prenatal course when you were pregnant?
We did. Even though I'm a maternity care provider, my husband and I thought it would be an important process for us to go through together.
That's so cute. It must have been so hard for you guys to coordinate your busy schedules, though.
Oh, tell me about it. I was a medical resident at the time, and he was working full-time. We really struggled to find a course that would fit our needs and ended up doing a semi-private course that still was challenging to schedule and quite expensive.
Wouldn't it have been nice for you guys to have access to an online course with evidence-based content that you could do from the comfort of your own home or on your own time at your own pace?
You're telling me if I had had access to something like our Pregnancy to Parenthood prenatal masterclass, it would have been a game changer.
And that's the big reason we put this course together, to provide parents with access to reliable, comprehensive prenatal education from the comfort of their own homes and the ability to watch it and rewatch it when and where they choose.
Plus, it's got so much great information about preparing for the fourth trimester, which I'll admit, I felt really unprepared for. We focus so much on labor and birth when we're pregnant without understanding how challenging breastfeeding in the fourth trimester can be.
I hear ya. And that's why we put together such a comprehensive module all about what to expect for the fourth trimester and for your newborn.
If any of you listeners are pregnant and thinking about a prenatal course, I may be biased, but I would 100% recommend our online course. Head on over to www.shefoundhealth.ca/masterclass to check it out.
We promise you won't be disappointed or your money back.
Would you mind touching a little bit on the timing of the vaccine in pregnancy? We get a lot of people asking us, they're scared to get it in their first trimester because they're worried about the risk of causing a miscarriage or pregnancy loss. They're scared, they don't know when to get their booster. Do you know much about the research around that and share what you would recommend?
Yeah, so there's been lots and lots of research about these vaccines in pregnancy now. I will admit that at the beginning, we didn't have the data, but still, immunologists and OBGYNs were saying that it would be safe, and that was because we know how vaccines work. We know how the immune system works. These vaccines are not different in the way that they cause your immune system to respond. So we knew based on decades of work in vaccines that they would be safe in pregnancy. But we now have clear data on COVID-19 vaccines specifically that look at this. And there's been a lot of data that looked and they see that there's no increased risk in miscarriage if somebody gets vaccinated in the first trimester. No increased risk. The background is the same between those who are vaccinated and those who are not. And we don't see any increased risk in any other pregnancy complications, such as birth defects or premature birth or low birth weight, anything like that. They haven't seen any negative effects associated with the vaccines in pregnancy. So I know that in the United States, the American College of Obstetrics and Gynecology and the Society for Fetal Medicine both strongly encourage vaccination at any point in pregnancy. So if you get it in the first trimester, that's fine. If the vaccine wasn't available to you until the third trimester, that's also fine. I think the biggest thing that has been stressed is that you need to be vaccinated because COVID-19 can cause such severe outcomes for people in pregnancy that what matters the most, right, is that you're not going to have a healthy baby if the mom doesn't survive to have a healthy baby.
Yeah.
And maximizing protection to the pregnant person is the most important. So I know even now with boosters, the ACOG and Society for Fetal Medicine have also made it clear that you can get a booster at any time that you're eligible. And now, especially with Omicron becoming the dominant variant, we see that a booster is really needed to give you protection against infection. So now more than ever, as soon as you're eligible, you should be getting that booster dose no matter what point in pregnancy. And I got my booster dose at 5 weeks pregnant. And I did have this debate, though, because I wasn't worried about causing a miscarriage, but I was like trying to think about maximizing antibodies. to the
Yeah.
fetus. I was like,
Yeah.
should I wait until I'm like later in my second trimester so the baby gets extra antibodies? And then I was like, no, it's fine. No matter what,
Yeah.
even if you're vaccinated early in your first trimester, you're still going to have background antibodies from that booster dose, from that initial vaccination
Mhm.
that will transfer through to the placenta. And what matters most is protecting you from getting infected more
Yeah.
than making sure the baby has antibodies when they're born.
Yeah.
So definitely getting vaccinated as soon as you're eligible.
I'm so glad you said that and that you really specified the importance. The vaccine is to protect the pregnant person and the mother. And it's so fascinating. And I mean, this we could go on a whole other tangent about as soon as you enter pregnancy and motherhood, your immediate thought is to protect your infant, your unborn child, your growing child, your teenager before yourself. But you can't parent, you can't be pregnant, and you can't birth if you get so severely ill. And it's so important that we remember that, like, you are so important to the pregnancy and to the parenthood that you have to stay well. The vaccine is about protecting you. And the bonus is that the infant gets exposed to the antibodies.
Yeah, exactly. And I think it's really, and I can give you links if you want to add them to
I would love to for
your
show notes.
references.
Yeah.
Yeah. But there's been so many papers that show that there's no, I know the biggest thing I think people are worried about is miscarriages.
Yes. Yeah.
And unfortunately, I think miscarriages are common anyway,
Yeah.
but people don't talk about them. So suddenly people like to say, oh, I hear about so many people having miscarriages. It must be the vaccine. But when we have this data now, we clearly see that there is no difference in miscarriage rate between somebody who's been vaccinated and somebody who has not been vaccinated. Miscarriages happen, but just because they happen doesn't mean the vaccine caused it. And we
Yeah.
now have that data that shows there isn't an increased risk of miscarriage. There's not, like with these vaccines.
Yeah.
So
I'll
hopefully
absolutely
that
share
can
that.
reassure. Yeah. So hopefully like that, there's now so many papers. I've lost track. There's multiple papers
Yeah.
now that show that. And I think it's great. We already knew that would be the case. As an immunologist, I was not concerned. Like I had friends who were pregnant and they were like, would you get vaccinated back in February? They're medical doctors. And they were like,
Mhm.
would you get vaccinated? And I was like, yes, if I was pregnant right now, I would get vaccinated. No concern. And that's just because we know how vaccines work. And then there's been a lot of information that these vaccines are new,
Mhm.
especially the mRNA vaccines, and that they were rushed or they're novel and not safe for some of whatever reason. But they're not. The way that they work is they work the same way as every other vaccine. They're
Mm.
introducing a very small piece of the virus into your body so that your immune system can see it and respond. And then what happens after that is exactly the same as every other vaccine.
Mhm.
And we've been studying mRNA vaccines for decades. We have lots of data. We have data from mice, we have data from monkeys, we have data from a bunch of animals that show no pregnancy concerns. So we had so much data, but I think it's important now that we have specific data to hopefully alleviate people's concerns. So now we can say, based on a whole host of data, that there is no increased risk of miscarriage or birth defects or early birth or any of those complications.
Yeah. All those complications that we know are associated with the disease.
Exactly. COVID-19, however, can cause all those issues.
Yeah.
And we do see that it causes all those issues.
Yeah.
So it's really important to protect yourself as much as possible from getting COVID-19. And the best way to do that is to get vaccinated.
Absolutely. I'm wondering if you can touch a little bit on booster doses. Some people don't understand why we need them. And if you can just sort of touch on what they do to the immune system and the importance of them.
Yeah. So I think there's been a lot of misinformation around
Mhm.
booster doses.
Yeah.
And I think people have to remember a few things. One is that we're in the middle of a global pandemic where people have been dying in numbers that are
Ugh.
impossible to think about.
Yeah.
And that means that when people were doing these clinical trials, they couldn't do 6-month intervals between dose 1 and dose 2. They couldn't do a year interval between dose 1 and dose 2 because they needed to maximize the data to make sure that they got the data they needed to show that it was effective and that it was safe, which they did get. But they did 3 to 4 week intervals in their clinical trials because that enabled them to get the data they needed more quickly. If
Mhm.
they waited 6 months between those 2 doses, we would
Yeah.
probably still be
totally.
waiting for vaccines. And we would have had millions and millions of more people die in the
Mhm.
process. So, because of the nature of these vaccines having to be rolled out in the middle of a global pandemic, we didn't have the luxury of trying all these different timelines. Versus other vaccines we know of, like when kids get vaccinated,
Mm-hmm.
they're given usually like the MMR vaccine. They're given at 6 months and then they get a booster dose and then they get another booster
Yeah.
dose. It's not unusual
Yeah.
to need to get multiple doses of a vaccine to develop the best immune response. And that's because your immune system gets better the more it sees something. So, my favorite analogy for this is if you have a door-to-door salesman come to your house. The first time that person comes to the door, you're going to answer it. You're going to start talking to them. You're going to realize they're selling you something. And you're probably going to be like, goodbye. I don't want it. Go away.
Yeah.
But then if they come back 6 months later, maybe they change their hat. It might take you you might answer the door again, and it will take you a little bit longer to recognize that person as being a salesman. But you're going to recognize them a lot faster than you would have the first time. And then if they come back a third time, you're going to open the door, see who they are, and shut it because you're going to be like, I don't want you at my house.
That's a great analogy.
And that's what happens to your
Yeah.
system. So the first time that it sees that spike protein, it takes a little bit of time to figure out what's going on. And then it makes that a memory response. And then the second time it sees it, it responds quicker and it makes more memory cells. And those memory cells are even better at recognizing that spike protein. And then with a booster dose or any subsequent dose, and again, it helps make sure that your immune system understands that spike protein does not belong and can recognize it. And importantly, it also teaches your immune system to recognize it even if it changes a little bit.
Mm-hmm.
So even if they change the hat or even if they change their hair color or they change their clothes, the more you see somebody, the more you recognize that person is the same person. And that's true for your immune system. The more it sees something, the more it can recognize that, even if it changes a little bit. And that's why with the Omicron data, you might be hearing that you need 3 doses to have sufficient protection. And that's because you need those 3 exposures for your immune system to be able to recognize slightly different versions of the spike protein more than before. And this is not atypical. This is very normal. Your immune system needs to see things multiple times to get really good at understanding it and being able to target it. That's why lots of things are multiple doses, 3, 4 doses in childhood immunizations. So it's not unusual to need a booster dose. And I also think people should remember that sometimes you have to get the flu vaccine, right? And you get that every year. Hopefully, you're getting it every year. And worst comes to worst, I don't necessarily think that COVID-19 will become a yearly vaccine. But worst comes to worst, it could become a yearly vaccine. But even if that's the case, that's not unusual. It's not abnormal to need a yearly dose of a vaccine. That's not that's not unusual. That's not unsafe. That's just because your immune system needs repeat exposures to maintain that level of protection that can keep you from getting sick.
Yeah, that's such a great analogy. And I really like, because Omicron now is coming out and people are worried that the vaccine isn't going to be protective. And so that descriptor and that importance of the booster, I think, is really reassuring for people to understand that they're doing everything they can to protect themselves. And we have to wait and see what happens. But from what I've understood, what we've seen so far, the vaccine does seem to be somewhat protective of Omicron.
Yeah, and especially with 2 doses, we're seeing, and this is really preliminary data.
Oh, yeah.
It could change, but
yeah,
we're seeing that with 2 doses, it still protects against severe disease. It's less good at stopping you from getting infected, but if you do get infected, it helps prevent you from getting severe disease, which is important. That's also
what we
really
want.
important.
Yeah.
But we're seeing that with a booster dose is helping to restore protection against even infection. So the booster dose is really needed to decrease your risk of getting infected, but then also on top of it, it's also making it even more so that you're less likely to get severely ill.
That's so good. Yay. Yay, vaccine technology.
I know.
Oh my gosh.
And
it's
they are,
amazing.
yeah. And they are making Omicron-specific boosters.
I heard that, yeah.
I don't know if we're going to need them, but they're making them, which is important. And if we do end up needing them, Pfizer said they could have theirs out by March.
Oh, it's amazing.
So we have that resource if we end up needing it.
So just before we wrap up this amazingly insightful conversation, I thought we could just touch on vaccination in breastfeeding and lactation. So sometimes people have been vaccinated 1 dose in pregnancy or none in pregnancy, and now they're lactating, and they're concerned, is the vaccine going to pass through my breast milk? If not that concern, what antibodies pass through the breast milk and how do they help the baby?
Yeah, so we have data now from lactation as well that show that the vaccine components themselves do not cross the breast milk. So they're not ending up in the breast milk. But what does end up in the breast milk are antibodies. And in the breast milk, you can get IgM, which are one type of antibody. Those can't pass through the placenta, but you're getting IgM and you're getting IgG antibodies in the breast milk. And we know that it will offer some benefit. So the baby, when the baby drinks the breast milk, they will get some of those antibodies. That is called passive immunity. So when you get antibodies transferred either through breast milk or through the placenta, that's called passive immunity because you don't have the rest of the immune system cells that you have if you were exposed or vaccinated. But those antibodies will offer some protection to the baby. How much protection is always a question I get asked. And unfortunately, we don't have that data. It'd be great. Those are hard studies to do because you have to it's just complicated. I wish we had the data that shows how much milk do you need to reduce the risk of infection by X amount, but we don't. But what we do know is it's going to offer benefit. And any benefit you can give until your child is eligible to get vaccinated is great. So those antibodies will pass through the breast milk, and we do know that they will offer some benefit if the child was exposed or infected.
Yeah, we just don't know how much, but I think any benefit is, and breast milk's just amazing in general.
Right. And there's a scientist I know, her name is Rebecca Powell, and she's in New York City, and she studies breast milk immunology.
Wow.
And it's amazing. She's awesome. And I can link to her website. She has tons of resources.
Oh, yeah.
She's looking into breast milk and COVID-19 antibodies from both infection and vaccination.
Yeah. That was great.
They're there. They're in the breast milk. It's just figuring out exactly how much protection they offer. But again, any protection is going to be better than nothing until your child can get vaccinated themselves.
Exactly. Oh my gosh. This has been such a great conversation.
Thank you for having me. I'm excited that I was able to be here.
Oh, me too. And I'm going to make sure we get this out ASAP because we're doing quite well here where we live. But I know that there's still lots of people that are not vaccinated in pregnancy and are just hesitant for completely understandable reasons. So I hope that this conversation just helps people really understand how the vaccines work, what they're doing to your immune system, and that they feel reassured that it's the right decision for them.
Yeah, I hope so too. And I hope people feel also comforted by the fact that I am a scientist and I chose to get vaccinated while pregnant.
Yeah.
I got my booster while pregnant. And I think that really shows people. And I know lots of medical providers and lots of scientists who did the same thing.
Yeah.
And that's because we understand what the data says and we know that it's safe. And we especially know that the virus is not safe. So anything we can do to maximize protection to ourselves and by protecting ourselves, we're also then protecting the unborn fetus as well. And you need yourself to be healthy to end up having that healthy baby at the end.
Absolutely. Oh my gosh, what a great conversation. So people can find you at Science Wiz Liz. I'll link that below, and you will send me some resources to share as well, correct?
I will. I'll send you a bunch of the papers in case people want to make sure that I'm not lying to them.
That would be great. And I totally respect people for wanting to see the literature, whether you can understand immunology papers. I don't think I could, but
yeah. And I think sometimes it's good to make sure. I think it's important that people always fact check.
I do too.
If somebody's saying something, ask for references. It's why I always include references at the end of my posts because I think it's important for people to be able to go to those, even if they can't understand them, at least go to those sources to know that they're actually there.
Absolutely agree. Awesome. Thank you for an amazing conversation.
You are welcome. And thank you very much for having me.
Oh, my pleasure. And enjoy, hopefully, a snowy holiday in Maine.
Yeah, I think it will be.
Bye, Liz.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.